Tugce Şimşek, an ENT specialist interested in facial plastic surgery. We intended to film an informative video on ethnic rhinoplasty in response to frequently asked questions from our patients. We'll collect your questions, provide a brief explanation based on them. Ethnic rhinoplasty is the type of rhinoplasty that we classify according to the ethnicity of the patients. Actually, when you look at it, all the people in the world classify themselves into certain different races. Caucasian race, African American race, Asian race, etc. Our rhinoplasty procedure primarily focuses on African American and Asian ethnicities for ethnic rhinoplasty. One of the main problems encountered in ethnic rhinoplasty, or rather one of the primary concerns faced by patients, is the presence of a low nasal bridge, a flat transition between the nose and forehead, as well as a wide nasal bone. Through the surgical procedure, we are able to provide an elevation on the nasal dorsum, perform augmentation, and create facial harmony by narrowing the nasal bones of the patient. Yes, typically there is a loss of cartilage support in the nasal region among patients with an ethnic nose in that area. We typically use the rib cartilage we take from the patient along with the cartilage here for ethnic rhinoplasty. We provide tip support along with cartilages. In addition, the second problem with African American noses is the thickness of the nostrils. With sufficient support, it is possible to achieve thinning with different techniques and create a smooth transition along with the straightness of the nose. Now, after the previous gynoplasty and other gynoplasties, our recovery period is on average 1 to 2 years for the nose to fully settle. After surgery, we have a cast on the bridge of the nose and a tampon inside the nose. We'll remove both after 1 week. Now, since most of our patients come from abroad, we cannot keep them under close observation. That's why, after the surgery, I am putting a splint on the nose bridge again 1 week after putting it in a cast. Actually, some patients need new plaster depending on the situation. They remove it themselves 1 week after returning home. There is a rapid decrease in swelling within 3 to 6 months, but as I mentioned previously, it takes approximately 1 to 2 years for it to fully settle into its shape. Yes, so ensuring that both nostrils are equal sized is actually a valid question for all rhinoplasties. Now we attempt to equalize the nostrils as much as possible. However, it's not feasible for all types of rhinoplasty, including ethnic rhinoplasty, to achieve nostrils that are 100% equal. We're making it as symmetrical. Yes, actually, this is a crucial question because these patients, in addition to complaining about their nose shape, desire to preserve the characteristics of their ethnic groups they belong to. That is the reason why we do not attempt to have a different ethnicity after we ensure it is compatible with the individual's face. We only ensure it's in a certain norm and create a nose compatible with the face. That's why there is no complete change in the ethnicity they belong to. Applies to all new-plus. If patient has breathing issue, we assess it to determine appropriate action. Anatomically, benefits can arise from mucus and cartilage in the nose. Nasal obstruction may occur due to lack of tip support and cartilage support in these patients. We also intervene in the same session while performing nasal surgery on these patients so that they can breathe through their nose in the same session. Ethnic composition of patients is different. Ethnic rhinoplasty requires experience. That's why it's necessary to analyze patients in detail prior. It's crucial to understand patients' expectations well. And accordingly, intervention should be done with a meticulous approach. Yes, like all tumors, there is an age limit in ethnic tumors too. Now, cartilage development is very important for us. This also reaches its maximum level around the age of 18. In fact, the rate of cartilage growth continues until the age of 21 in men. That's why we can say 18 years old is the lower limit in terms of ethnic plastic surgery. Yes, it's effective as mentioned before. One of the plastids, it's necessary to work with experienced surgeons in this field. For patient satisfaction, experienced surgeons should perform this procedure. See you later on.